All right, now you've begun to develop a draft of a logic model to help you implement an initiative. And so now we're going to turn to evaluation, as this is equally central to good design. Being a change agent is not just about advocacy, it's also about having the capacity to inform and guide the relevant stakeholders in their deliberations, and decisions about such matters is the work of evaluation. Evaluation of initiatives, activities, or programs is an enormous and ongoing concern across health and social services, including public health palliative care. Now, some of the reasons that evaluation is important is that you want to be able to assist in ensuring the initiative is effective, and also to be able to strengthen existing ones and ones that will come in the future, to know more about people's insights and experiences, and then to generate best practices, which is also known as evidence-based practice. To highlight the value of the initiative in context of where it is operating, and also to map what's changed. So this is also what is known as processes and outcomes. So what processes the initiative is using and what impact the initiative has had, including participation, empowerment, and other health outcomes. This makes valuation central to a whole range of stakeholders, including policy developers, funding organizations, planners, program managers, taxpayers, and those who are either the audience or participants of the initiative. So this can be as small as the local group you're engaging with. It can be to community organizations you might want to link in the future, all the way up to more formal funding applications. We're now well aware that community engagement is acknowledged as contributing to important outcomes in health and well-being, and as a central part of public health palliative care interventions. We also know that the goal of these initiatives is to enhance individual and community capacity. But both of these can be tricky to evidence. So both community engagement itself and then changes to capacity. So while compassionate communities offer much promise, there's currently little insight as to their results. Do compassionate community initiatives achieve what they set out to do? And if they do, what counts as evidence? In this lecture, we're going to explore different forms of evaluation and some different creative evaluation methodologies that you might find useful. Now, as a note, much of this material comes from program evaluation. So I'll be using the terms program, initiative, event, and activities relatively interchangeably. Let's get started. At its most basic, program evaluation is the systematic collection of information or data about activities, characteristics, or outcomes of initiatives, and to report and communicate the results to stakeholders and community. Now, really the goal here is to answer key questions about the performance of such programs. So evaluators will apply social science research methods to provide answers to stakeholders. Now, evaluation sometimes is synonymous with developing an implementation plan, but here we're going to talk about it as a separate, although part of designing a overall project or initiative plan. So while program evaluation uses research methods, it's different from research because research is focused primarily on contributing new information to the field, where evaluation takes real-world contexts and focuses on how programs have been implemented and what we need to know about them to make future choices. So in particular, much of the focus in evaluation is on processes and outcomes. And we know that from the previous lecture, processes are the activities that a program engages in, and outcomes are a program's results. So what evaluation does is it helps to understand how well the work actually occurred, both in the processes as well as whether the intended outcomes were or were not achieved. And so in the previous lecture where we looked at different models of implementation, those are kind of maps of how to do something. Evaluation is looking at how that doing actually unfolded. So it's important to know that program evaluation includes a discussion of what didn't work as planned, as well as mapping on unexpected outcomes. Program evaluation can be very formal and complex, but it can also be very local and relatively straightforward. It really depends on the goal of your evaluation, alongside the resources you have available and who your intended audience is. Now, you may or may not have come across these concepts or terms before. If not, don't worry. Really, at the heart of all of this is an interest in mapping if and how a set of activities has followed a certain process, and if it's had its intended impact. Your starting place is to begin by asking, what is the goal of the evaluation, and what processes and outcomes do you want to examine? There's no set path to what you need to include in your initiative. By and large, the parameters will be set by the purpose and goals of the initiative itself. What is the kind of program, project, activity that you have that you want to think about how well it did or what it did? So in relation to compassionate communities, in Sal No's article, her and her colleagues in their systematic review described a range of ways that compassionate community initiatives have been, by and large, descriptively evaluated. And so they described the mobilization of community resources, either through natural occurring social networks or externally facilitated ones. Also, how those developed through support of trained community volunteers. Other projects describe attempts to influence society's perceptions and reactions to death and dying, such as through work with schools, businesses, or professionals, or offering seed grants to communities to develop that work themselves. Others still focused on awareness, education, and training of community members directly in topics such as writing a will and advanced care planning, or efforts to explore society's perception of issues through local or national conversation. So you know the list goes on. You could look at policy examples where lobbying from local services and communities have led to policy reform, and how environments can be shaped through policy, or community participation in health service development, implementation, and evaluation. And so this also has been categorized as the involvement and mobilization of community resources, changes to perception, awareness, education, and training of community members. The goal here really is to ask yourself what it is you want to measure. Has this initiative made a practical difference? Is it about individual learning and personal growth, experiences of participating, changing attitudes and values, use of services, relationships between people, or more generally developing community capacity? So the goal of what a initiative is to address an issue. In an evaluation plan, the written goal should state the problem or the issue the program or initiative is trying to address, and then to be able to use that as the anchor for which to base your evaluation in. An important question that also needs to be answered is, who will be the main users of the findings and how will they be engaged? Answering this question will help determine not only what aspects of the project to evaluate, but also whose perspectives are being included in the evaluation. So, stakeholders are individuals and organizations that have an interest in or are affected by your evaluation and its results. And it's helpful to identify stakeholders and their information needs. What might be useful to one stakeholder may not be useful to another. The three primary audience, or the three types of audience for evaluations, are primary, secondary, and tertiary. Primary audiences are often the individuals who are the everyday partners in the program. Primary audiences are often the individuals who run or are involved in the program, such as funders, those who will use the results to make decisions about either the evolution of an ongoing initiative or the next project, or how this one can build on future ventures. This audience would be considered the primary intended users of the evaluation. Secondary audiences have a more limited direct involvement with the project, but are still interested in the evaluation report because the results may affect them in some way. If you're wanting to drive further expansion and change, your audience may therefore also include charity funding groups, local government representatives, or policymakers. Tertiary audiences may or may not have a connection to the program, but they're still interested in hearing about it and seeing the results of the evaluation. This audience includes the public. So it's important to know who these are, your audience, as you engage in evaluation. It will shape not only what you evaluate, but who you include in the evaluation, and also what kind of framing information you want to include. Evaluation can be classified into 5 types by intended use: formative, process, summative, outcome, and impact. Formative evaluation provides information to guide programs before they start, often as needs assessment. Process evaluation determines whether a program is delivered as intended to its targeted recipients and participants. Formative and process evaluations are appropriate to conduct during the implementation of a program, so near the beginning. Summative evaluation informs judgment about whether something has worked, whether the goals and objectives were met, and requires making explicit the criteria and evidence being used to make summary judgments. Now, outcome and impact are forms of summative evaluation. Outcome evaluation focuses on observable conditions of a specific population, organizational attribute, or social condition that the initiative is expected to have changed. So this is a little bit different from impact evaluation, whereas outcome evaluation tends to focus on conditions or behaviors that the program was expected to affect most directly and immediately. Impact evaluation examines the project's more long-term goals. Now, I wouldn't worry too much about differentiating between impact and outcome, really you want to think about the three, which are the formative, process, and summative. And in relation to the summative, whether it just using that general category of summative, which is near the end or at the end of a project, it's appropriate to conduct when the program has either been completed or has been going on for a substantial amount of time. Each of these evaluation types are not necessarily mutually exclusive as well, but one purpose is usually more dominant. Many evaluations contain a scope of these different aspects that are used at different points in larger projects, whereas smaller projects may just use one. And so let's just take a closer look at each. Formative evaluation ensures that an activity or initiative is feasible, appropriate, and acceptable before it's fully implemented. So again, it's usually conducted when a new program or activity is being developed or when an existing one is being adapted or modified. The overall purpose of a formative evaluation is to help shape the future of the activities or the program concerned. And so since it's done early in the life cycle of a program, the development and implementation stages, it really provides information that can be used to make changes early on. And it can occur at multiple points in time. So while I've been saying that it is early on, it is usually done before, during, or after a program is implemented. So a formative evaluation tends to be more focused on learning and management than outcomes. And really, for new programs, the frequent concern is about basic implementation issues. Essentially, how well did this idea transfer from paper to the real world? And so you can see here, I've got the arrow pointing to the beginning of the logic chart, because many of these kinds of questions fall within the domain of formative assessment. Is this going well? How do I know it's going well? What are the beginning stages? Because it can guide the rest of the implementation over time to improve performance. Process evaluation determines whether program activities have been implemented as intended. It's used to determine how and why programs have changed over time, and to accurately describe the initiative to outside parties. What it does is it helps stakeholders see how your initiative, how the outcome or impact was achieved through specific processes. So you can conduct process evaluation periodically throughout the life of your initiative. And you start by reviewing the activities and output components of the logic model, which again is on that left side. The results of a process evaluation, what they do is they strengthen your ability to report on what it is that you did and use that information to improve future activities. It's a form of kind of real-time scanning. It allows you to track information related to the who, what, when, and where questions. So it's things like, to whom did you direct your efforts? What are the concrete things that your initiative or your event did? When did the activities take place? Where did the activities take place? And, what are some of the barriers and facilitation to the work that it is that you were doing? Okay. Now we come to the last of the summative evaluation. And this measures the progress in the impacts and outcomes that you were trying to achieve. And in contrast to a formative evaluation at the beginning, a summative evaluation occurs at the end of the project or your program or set of activities. And it's designed to assess what has been achieved and how. And so summative evaluations are often implemented when the project or the event is over or is about to end and it's not really possible to make changes any longer to what it is that you're doing. Now here then the goal is that lessons can still be learned that would help shape future initiatives that are similar. Sometimes, as I said previously, summative evaluations are also described as impact or outcome evaluations. And different people and organizations use these terms differently or even interchangeably, so it can get confusing. For our purposes here, summative evaluations encompass both long and short-term results, focusing on the changes in comprehension, attitudes, behaviors, and practices that result from the initiative and its activities. So to design a summative evaluation, what you do is you begin with a review of the outcome components of your logic model. So those are the categories on the right-hand side. And questions that summative evaluations try to answer are, did the program succeed in X behavioral change? Was it more successful with a certain group of people than others? What aspects gave the greatest benefit? So some common shorter term indicators you could look for example, are changes in awareness, knowledge, and skills, changes in intended behavior, in individual capacities such as confidence, self-esteem, social skills, problem-solving skills, increased help-seeking behavior, or things like coping skills and optimism. This also includes increased confidence, but you could also look at increased social networks and improved relationships. And so there's a whole range again, and this will go back to what it was the goals were of what you were trying to do in the first place. So importantly, if you're going to look for changes in a summative evaluation, you do need to think about this because in order to measure these fully, you should be collecting data at the start of a program, and this can be as straightforward as having a questionnaire at the beginning and the end of your event or project. So we've had a look at the goals, audience, and main types of evaluation. So our next question is, who's going to do the evaluation? And unsurprisingly, the answer is, it depends. External or independent evaluations are carried out by a person or team who are not part of the project or program being evaluated, or part of the organization carrying out the project or event. This is probably the most common type of evaluation, but it predominantly happens when there's funds to hire a consultant or you have access to outside expertise. A joint evaluation can mean one of two things. Firstly, it can mean an evaluation carried out by both internal and external people at the same time. And so this can mean getting the best of both worlds. You have internal people who know the context, while also bringing external people with potentially greater expertise and potentially objectivity as well. A joint evaluation can also refer to an evaluation that involves people from different organizations. Peer evaluations are carried out by people within the same organization, but from a different project or program or department than the one that you are in. And so, for example, if you're working in the NHS, this can be, or if you're working in a large nonprofit or charity organization. Now, a participatory evaluation emphasizes the participation of key stakeholders, especially the attended beneficiaries of a project or an event. Sometimes beneficiaries are only involved in the collection, analysis, and use of data, but sometimes beneficiaries, your participants, can lead the process themselves. And this is a common format for smaller projects, and participatory community engagement and empowerment projects. And so a participatory evaluation framework is one that, particularly in public health palliative care and compassionate community initiatives, is particularly popular. Finally, evaluations can also be categorized according to the primary methodology used to collect and analyze your data. Smaller public health palliative care initiatives, such as most compassionate community initiatives, or what could be captured under the umbrella of that term, primarily use qualitative methods. They are in contrast to larger mixed methodology evaluations of interventions that use a public health approach more based on the WHO focus, so the World Health Organization. So looking at access to drugs, or looking at levels of coverage. So those will use randomized control trials, quasi-experimental approaches, or qualitative comparative analysis on a large scale. Here, though, I really want us to focus on what is most common and what you yourself might find useful and be able to do. So think about what methodologies you want to use based on the type of intervention or the event you're engaged in and what you want to find out. Is it about how to best design a project, to better understand how a project is going, to find out if anything has changed due to the initiative? And so trying to answer these questions may require the use of different tools, but common ones include pre and post testing that I was talking about before. So whether that be through standardized tools or just questionnaires that you yourself have developed. You can also use surveys, interviews, focus groups, diaries, or reflexive writing. You can engage in observation, and you can look at doing social network analysis. Now, we'll be going into further detail about some of these methods in our Theory, Ethics, and Methods course if you haven't already taken that. In the meantime, I'm also including some toolkits in the course this week that have been designed for those interested in developing and implementing and evaluating Compassionate Communities Initiative. And they have some interesting, if partial, information that you can borrow from. I want to just spend a moment on some of the core challenges in conducting evaluative research for initiatives that are focused on community engagement and empowerment, or about an individual's engagement and empowerment. These are multi-level and multi-dimensional concepts, and conventional indicators, conventional evaluative indicators can be insufficient to measure this complexity. Now, community engagement in end-of-life care is increasingly recognized in policy documents, and practice examples exist worldwide. Now, along with the potential promises offered by the idea of compassionate communities, implementation and evaluation reports in these publications that we've been looking at, they've offered different ways of defining communities and health needs, motivations, different ways of participating, conditions and actions necessary for engagement, and the potential issues influencing impact. And really, this is great because evaluation is considered a cornerstone of evidence-based practice, which is still currently the predominant framework for understanding and valuing health and well-being by health and social care agencies and policymakers. With the importance of measuring outcomes in community-involved end-of-life care recognized, so this means also that there's a need to understand and measure the impact of this work. However, interest in these approaches has not been matched by a rise in the evidence supporting their use, and currently little exists regarding the impact of such initiatives. And in part that's because some of the indicators that have traditionally been applied from public health to these community engaged, community-led, community-involved interventions are problematic. And so even though, as Salno and her colleagues note, because of this interest and diversity of approaches to evaluation, there's been this wide range of sharing of tools and innovations amongst those who are implementing compassionate communities, or ideas and initiatives about compassionate communities around the world. It also can make for greater complexity that can challenge evaluation. So existing indicators are potentially problematic, as well as the diversity of alternative indicators can feel a little bit overwhelming. Because community engagement and empowerment is about trying to do things differently and often much messier with uncertain, changing, or unanticipated outcomes, we also need to question what counts as evidence and what can and should be, quote, measured. Evaluation often relies on change in specific indicators as evidence of effectiveness. And as I said, many indicators either are inappropriate or they continue to be ill-defined, and there can be exaggerated claims of the use of what they're actually showing. Others can be too ambitious for smaller evaluations, such as reduction in hospital admissions for older people. And these deficiencies in both conceptualizing and method of developing indicators can make it difficult in trying to figure out what to look at and how to communicate those findings within priority setting and program evaluation or events, smaller projects, particularly in regards to some key aspect of small scale community development, change, and empowerment, particularly if your intended audience for your evaluation are community members or at least secondary audience members. So what we want to do is see the importance of creating an evidence base through engaging in program and project evaluation. You want to share and show people that the work that you've done or that you've done collectively with communities has had real impact. But it also means moving from evaluation being exclusively focused on the linear causal chain between the intervention and the so-called target population to seek to build understanding of whether and how what is known as lay contribution, this community engagement, has impacted broader social determinants of health, including changes to the way systems are structured, including potentially through which the intervention is delivered. So again, about evidencing not necessarily this has led to a direct reduction in hospital stays, but rather how has participatory engagement potentially changed the system itself, not linearly just as communities of recipients of change. I'm going to end with offering some examples of specific creative strategies that can be used in all forms of evaluation, including formative, process, and summative. And I'm doing this in part because, we talk about indicators in relation to challenges, and that can feel kind of abstract. And really, these creative strategies to help people engage in evaluation just kind of grounds this conversation, and because these can be used as forms of quote-unquote evidence and are powerful ways to engage people with their understanding of the initiative and the benefits and the changes. So I offer these as a way of thinking about how to collect data to evidence both your processes and outcomes without having to necessarily rely on conventional and often abstract and not always entirely relevant indicators, which may not be able to adequately capture many of the actions, processes, and outcomes that constitute community engagement, communication, and changes to specific capacities, skills, beliefs, and behaviors. I'm going to end with offering some specific examples of creative strategies that can be used in all forms of the evaluative process, including formative, the process aspects, and summative. I offer these as a way of thinking about how to collect data to evidence both your process and outcomes without having to necessarily rely on conventional and often abstract and not entirely relevant indicators, which may not be able to adequately capture many of the actions, processes, and outcomes that constitute community engagement, communication, and changes to capacities, skills, beliefs, and behaviors. There are a range of photographic engagements you can use. There's photo mapping. This is mapping the infrastructure on a map, a photo map made by participants, for example, of the support and health services in the area. It's a good evaluation of the built environment and specific health outcomes. There are photo essays, which is the technique used to describe people use to describe themselves or their own view on something. So they can take photos, create captions, and a description. In particular, relationships, social settings, and personal characteristics can be the topics. There's also photo voice, which is similar to photo essays, often with less written feedback and using usually a guided question. The goal here is for there to be a public exhibition to elicit discussion, particularly amongst stakeholders. There's also photo interviewing, the use of photographs as stimulus during interviews or to structure discussions about a program or project. You can engage in group discussion using card procedures. So this is where a set of cards are used to encourage group discussion with questions that come under various topics such as identity, relationships, values, emotions, and beliefs. These cards are resources that encourage the discussion of feelings and beliefs with activities to assist the process. So generally, cards are used as a source of stimulation for discussion and can be particularly great in the formative aspects of your evaluation and project planning. There are also simulation, role play, and scenarios which can be really useful. Online simulation of real-life events can be used to look at coping skills or changes in behaviors, particularly for people who learn by doing. And so these scenarios are often more successful than conventional techniques for capturing information. So you could have people engage in these online simulations before and after an event or an initiative and look for changes. Role play is characterized by designated interpersonal vignettes in which the participant is assigned a role and instructed to respond to a series of structured prompts. And role play is an interesting way to facilitate naturalistic observation while preserving a real-life element that can be lacking in self-report measures, because it's been shown that self-report measures such as questionnaires reflect perceptions more than they capture capabilities. And then similar to simulations, in scenarios, participants read or are read a brief description of a specific social interaction. And then this is followed by multiple choice items or a structured interview querying interpretation of this exchange, potential responses, solutions, and outcomes. And the use here is that it collects different forms of data, because the multiple choice or structured interview enables self-report measures that can be useful, and particularly if you use these simulations in focus groups where the interaction between people talking about these results can also generate new sources of insights and be useful to evaluating your project or the work that you've been doing. Social network mapping, or more generally mapping, social mapping, involves the formation of a diagram that shows an individual's social network or different aspects of these networks. It shows the support network possibly accessed by the participant, for example, and can demonstrate trust, friendship, families, and communication. And for example, participants can be asked to think of up to 5 people they talk to about certain important matters, and then 5 people they talk to about their healthcare decisions, others that they would go to for practical support. And so this is a listing of different levels of connections that can be looked at as based on bridging or linking social capital and different forms of engagement. And here you could think back to the exercise we did earlier in the semester when I had you do something similar. And the nice thing about networks is they're easily hand-drawn by participants, and then you can transfer that data later into a more formal chart or diagram. Collage is an example of an arts-based evaluation methodology that positions people in engaging and participatory ways. So collage is, the cutting, arranging, and sticking down of images, text, drawings, or color that can be taken from a variety of sources. And collage can be as technologically sophisticated as you want it to be. You can use the Photoshop or the internet, or as simple as the resources that you have. So scissors, paper, glue, and a bunch of magazines. And the process of making a collage can often generate really interesting topic-related conversations amongst your participants. And these discussions can be recorded and analyzed, as well as the collage itself being a form of evaluation data. Last but not least, there's digital storytelling and pop vox. And so the term pop vox comes from the Latin phrase vox populi, meaning voice of the people. Traditionally, the vox pop is a tool used in media research to provide a snapshot of public opinion. Random participants are asked to give their views on a particular topic, and these views are a reflection of popular opinion. And this can be really useful when you're doing a needs assessment, or where you're looking at different ways of engaging with the formative or process parts, the earlier parts of evaluation. Digital storytelling, on the other hand, involves making usually short films that tells ordinary people's real-life stories. This involves meaningful workshop processes and participatory production methods, and so it's a bit more complex, but The final product tends to be the first person narrative, which can be incredibly powerful form of evaluation and as ways to communicate about the value and the processes and outcomes of the event or larger project that you are engaging in. Program evaluation is enormously important in all areas of health and social care across all levels of government, charity, and community organizations. Having a basic understanding of what evaluation is and the different ways in which you can evaluate provides you with a starting point in developing or participating in developing an evaluation process, and it will be able to evidence the value and outcomes of your initiative or initiatives that you are critically engaged in with. Now, as a last reminder, don't let language get in the way. The language of outputs, outcomes, indicators, etc. can sometimes exclude people, presenting evaluation as something that only, quote, experts can do. This isn't the case. Evaluation is simply understanding the object of the evaluation and learning from action.